Welcome to Telehealth Presentation by Michelle Torregrossa, Karen Torsk, and Jane Turney from Jacksonville University School of Nursing, September 28, 2013. What is telehealth exactly? The use of telecommunication and electronic information to exchange information that is pertinent to provide and support healthcare-related services. There is a distinction between the term telemedicine and telehealth. Telemedicine initially was the term for the delivery of care and services via technologies and computers. The American Nurse Association preferred term is telehealth. This is because telehealth is actually a more inclusive and accurate description of the services that are provided. Services include health promotion, disease prevention, diagnosis, consultation, education, and therapy. What are the functions and capabilities of telehealth? Telehealth allows a provider to perform consultations and interviews, assess and monitor clients, obtain and review pertinent client data and results, and provide education to clients. By way of performing consultations and interviews, providers are allowed, with the use of telehealth, to do this over great distances. There could be a physician in another state that can be consulted and interview clients through the use of telecommunications. We are able to assess and monitor clients outside of the hospital facility. Obtaining and reviewing pertinent client data and results is by way of using the information systems that are available to us within a hospital, a physician's office, and so on and so forth. Providing education is made allowable through telehealth by way that we can video conference with clients and speak with them over the telephone in order to give education. Also, by way that consumers, being the client, are now able to surf the web and find information for themselves regarding their health and prevention of illness or promotion of their health in general. The goals and purpose of telehealth are to decrease hospital admissions and emergencies, improve the management of chronic illness, improve the functionality of the nurse and other disciplines, reduce healthcare costs, and provide and improve access to healthcare. Telehealth decreases hospital admissions and emergencies through the more frequent monitoring of patients' health status and providing a more frequent treatment of their chronic illness. This prevents a client from having an exacerbation of their chronic illness, therefore decreasing the necessity to see an emergency room visit and possibly a hospital admission. Telehealth improves the functionality of the nurse and other disciplines through an application of information system and technology and telecommunication to complete their duties and tasks. Telehealth helps reduce healthcare costs by the fact that clients no longer have to endure high costs to acquire healthcare just simply for transportation means. It reduces healthcare organizations' costs by decreasing the amount of time that would be applied to visiting these clients, or less time that's needed to obtain information. And now that telehealth is being used, decreases the time that's applied to complete tasks. Telehealth provides and improves access to healthcare by allowing clients who are either in rural areas or areas that are unable to reach a healthcare facility, obtain healthcare providers' attention either at their homes or their community. The environment of telehealth application is done in a healthcare clinic and hospital, physician's office, a client's home, prisons, call centers, and in the military. Telehealth is applied in healthcare clinics, hospitals, and physician offices anytime a provider uses the telephone to communicate information regarding a client's care. With the advancement in technologies, providers now use information systems through their computer, or they communicate information by way of fax. The use of telehealth in a client's home is through the use of a telephone, a video conference, or a teleconference to a client that requires healthcare from a provider. The use of telehealth application within a prison system is when a prisoner receives healthcare from a provider that is outside of that facility through the use of technology. Call centers that generally have a provider answering calls from clients and answering information related to health promotion, health prevention, or emergency matters. The military has used the use of telehealth applications to care for their members when healthcare needs are unable to be met in the area that they are. History and development of telehealth began with the use of the telephone, when a provider used the telephone system to communicate information regarding a client's health and care. Reasons for advancement in telehealth are due to the progressive advancements in technology, the need for improved care, especially for those clients who are large distances from a healthcare facility or a healthcare provider. The increased need for cost savings. This is actually being delegated by the government. Clients require a reduction in cost savings for transporting themselves to and from healthcare facilities and having to go great lengths in order to obtain appropriate health care. This also reduces cost savings for healthcare providers and organizations by way of reducing the amount of time that's required to accomplish their tasks and duties. Contributions to the evolution of telehealth usage is greatly dedicated to a few organizations. NASA was extremely aggressive in the development of telehealth. Also, states using telehealth for the care of their prisoners. The government has been an influence, and so has research. NASA used telehealth to provide assistance for clients who had suffered from an earthquake, and the area that they were in was in such a devastation that they were unable to acquire healthcare providers to help care for their injured. The states, there are multiple states that have used telehealth in the use of care for their prisoners. Prisoners using this system are no longer required to leave their facility and to receive health care. Therefore, it reduces the amount of cost in order to transport these prisoners to a healthcare facility. It also reduces any safety risks imposed by having the prisoners outside of their facility, and also reduces risks by not requiring physicians or nurses outside of the facility to come into a prisoner facility. The government has been influential on the advancement in telehealth by requiring telecommunication carriers to offer services for clients in rural areas at a comparable price to those in urban areas. Therefore, in reducing the amount of cost it takes for a rural area client to obtain telecommunications, a telephone system, or internet connections, they are now able to afford the connection it requires to get healthcare advice or consultations or visits from a provider that is a large distance from them. Research has been done on from many organizations regarding telehealth. The ultimate conclusion has been that telehealth will soon become an integral part of the healthcare delivery services, and it will continue to evolve. Telehealth nursing is the use of telehealth technology to deliver nursing care and conduct nursing practice. Telehealth nursing, although is not a specialty area in nursing, it does require a special knowledge base in order to complete tasks using telecommunications and health technologies. Nurses require to be competent in the use of delivering nursing care over a distance and obtaining information using an information system and communicating either by telephone, fax machine, or the computer system. The American Nurse Association has developed a scope and standards for nursing practice regarding specifically to telehealth. The American Academy of Ambulatory Care Nurses also has developed a specific telehealth standards that nurses should meet in order to care for clients. The International Council of Nursing has developed competencies that apply to nurses in the USA, Canada, and over 130 countries globally. What is telehealth nursing? The American Telehealth Association defines telehealth nursing as the use of telehealth telemedicine technology to deliver nursing care and conduct nursing practice. Telehealth nursing is utilized daily by all nurses. Any nurse who provides care through audio, video, data, or telephone communications are providing telehealth nursing. Nursing roles. Nurses can assist the aging population, individuals with chronic diseases. Community and home-based care needs can be met through a nursing role. By use of telephones, fax machines, smartphones, voice and video teleconferencing, and the internet, nurses are able to provide many things for a client. Nurses are able to provide follow-up calls, consults, test results, biometric measurements, physical instructions, and education. The nursing role, as stated previously, also is inclusive of following the established nurse practice standards by the American Nurse Association and International Council of Nurses. Applications for telehealth can be divided into two categories. The application is either high-tech or low-tech. Examples of high-tech applications for telehealth are real-time video conferencing, transmission of diagnostic images, and electronic prescriptions. Examples of low-tech applications for telehealth would be glucose monitoring, blood pressure monitoring, education for healthcare providers and consumers. Teleconferencing and video conferencing are types of telehealth. According to Habda and Czar, the terms of teleconference and video conference may be used synonymously because they both use telecommunications and computer technology. Individuals are able to meet face-to-face and view the same images through the use of telecommunications and computer technology, even though they are not in the same location. Advantages of this application of telehealth is that it saves travel time and cost, increases frequency of meetings, and it's available with many applications. Examples of telehealth monitoring are blood pressure monitors, heart sounds, telemetry monitors, blood glucose monitoring, oxygen levels, respiratory peak flow, and weight measurements. There are many benefits of telehealth. Telehealth meets a demand from society and government.
Society is becoming more educated through the use of the internet. They want to know more available options, which doctors to see, and how to be treated. Telehealth can provide more health information to the underprivileged. These underprivileged patients that are unable to see a physician or make a doctor's appointment, they're able to do research on the internet for caring for themselves. Patients can be treated sooner with the use of telehealth. If patients are aware of the consequences of not being treated, they're more apt to go to the hospital or a doctor and seek out the care that they need. Telehealth improves the quality of care. Patients receive better care because they know what to ask and what is supposed to be done. Quality of care is improved also through the increase of quality of communication between healthcare providers. It allows for a continuity and more fluid healthcare system. Follow-up care is improved, secondary to the use of telehealth. Patients are more likely to follow up on their own care if they're knowledgeable about their disease process. Digital information can be maintained on a computer, such as vital signs, images, and health records. Telehealth also provides time saving for the provider. The doctor can pull up a patient's information from his computer at home or wherever they may be. Telehealth provides expert advice to the community, can look on the internet and receive expert medical advice. E-health information can gain medical staff. Medical staff looking for jobs or other employment can look on the internet at the hospital they are interested in. They're able to see a multitude of information in regards to the hospital. Healthcare providers, as well as clients, are able to complete their own private research of healthcare conditions, diagnosis, prevention, and medications. Telehealth provides lower costs for patients. If a patient can get to an expert advice over the internet or telephone, this saves the patient money such as copays or other expenses incurred by traveling to the facility. Telehealth allows communication across the world. If a physician needs to speak to another physician in another state or country in regards to the patient's health, they can use the telephone, teleconferencing, or video conferencing. Telehealth has an effect in nursing. It provides centralized records, education, video conferencing, vital signs, elderly injuries, disease management, and wireless monitors. Centralized records would allow the nurse to find more information about the patient, such as history, labs, physician notes, rehabilitation notes. This saves the nurse time digging for the information using another avenue. Education is affected for nurses and patients. Patients can watch video designated for the specific disease process that they're researching, and thereby improving their overall health when they use the knowledge and apply it to their own health care. Vital signs. Patients' vital signs can be monitored at a central monitoring station. This supports nursing practice. Video conferencing. Nurses, patients, doctors, and other healthcare disciplines involved can discuss the management of a client and care involved, improving the quality of care. Effects in nursing with the elderly by using telehealth. If a patient falls at home, it can alert the nurse of a fall. Information technology is evolving and improving the care of clients inside healthcare organizations and in rural areas or places outside of the hospital. Disease management is affected by way that a patient has a capability of looking up information on the computer to get more details about their specific disease. Also, other healthcare members can discuss the disease management of the patient via teleconferencing, either provider to provider or provider to client. Wireless monitors are an asset to nurses. Heart monitors are a good example of telehealth. Patients are able to move about for rehabilitation or procedures that they need to leave the nursing unit for without being connected directly to wires that plug into a computer. Giving the patient freedom helps prevent falls or injuries to the patient, and their heart rhythms can be monitored at a central monitoring station, and they can alert the nurse for any dysrhythmias. There are many challenges of telehealth. The challenges of telehealth are maintaining privacy for the clients, licensure issues, reimbursement and costs, technical support and training, liability and lawsuits, possible misinterpretation, the ability for a nurse to take orders, standards are not uniform, funding, accreditation, and outages. Privacy, maintaining HIPAA standards, is a concern for all patients. By using telecommunication and sending patient information across using different technologies from one place to another is an issue that telehealth has to maintain the privacy and confidentiality of the clients that are being served. Licensure issues for telehealth capability and for practicing healthcare members would require a license for each state that they practice in. Reimbursement and costs is a challenge for telehealth. Medical codes are not yet available for the billing of telehealth services. Providers do not get paid if they see a patient via telehealth. And this is because the medical area of coding has not been established yet for telehealth services. The cost of a new infrastructure would have to be done so that the new reimbursement codes could be established. Computer systems would have to be updated with these newer codes to receive reimbursement. Technical support and training would be a necessity for all staff members, including nurses, physicians, and ancillary staff. Technical support would play a key role in the training of staff and maintaining the system. Liability and lawsuits is always an issue in healthcare. Liability, the lack of a physician or a nurse not physically seeing the patient, could put those providers at risk for a lawsuit. Lawsuits can be filed across multiple jurisdictions since the nurse and physician are practicing across other states. Misinterpretation is always a concern if communication is making its way to a client. A client may misinterpret information from the nurse or physician. Nurses are unable to take orders from physicians if the physician is not licensed in that same state that the nurse is practicing. A nurse must also be licensed in the state of a physician. Standards are not uniform for healthcare using telehealth at this time. If the physician is not able to physically examine the patient, it could lead to issues, especially if something is missed. Example, not auscultating the lungs with a stethoscope or looking inside an ear with an otoscope, etc. Being that there are not standards that are uniform for medical practice by use of telehealth, that puts all practitioners using telehealth system in jeopardy. The American Nurse Association and International Council of Nurses have developed standards and competencies for a base of knowledge for nurses to practice from. Funding can be very costly for an infrastructure, training, and maintenance of a telehealth system. Accreditation. As stated before, a physician or a nurse must have a license for each state that they practice telehealth in. Accreditation for a organization that performs telehealth. If it's a hospital organization, they already have their accreditation standards. But if there is, say, a call center that provides nothing but telehealth consultations or education, there is yet to be an accrediting body for such a facility. Outages for telehealth systems not being able to access EMRs for patient care at this time. The government is encouraging all healthcare organizations to obtain such a status. In conclusion, the future outlook of telehealth is that telehealth will change the way healthcare will be delivered. Telehealth will also benefit healthcare providers and the receivers of care. Although telehealth presents many challenges, it appears that those challenges are able to be overcome, and the benefits of telehealth greatly outweigh what the challenges are. It's been determined that telehealth is an absolute necessity in healthcare of the future.